Okay, everybody, this is Nurse D. Welcome back to my channel. Tonight we're going to be talking about nursing agencies. Okay, I've worked with several nursing agencies throughout my career. Even when I worked with nursing homes, worked in a nursing home or worked in a hospital, I always had a client through a nursing agency. Nursing agencies are for nurses who don't want to actually have a set schedule through a hospital or a nursing home. You can choose your hours, you can choose your days. You can choose whether you want to work with one client or whether you want to work with two clients. You can choose to work one day a month, one day a week. You can work 5 days a week, 7 days a week. It's up to you. You can take off when you want to. It's not like in the hospital or the nursing home that you actually have to put your time in and see if it is approved. When you're working with a nursing agency, you have the option to never take a vacation. But most of the time you're going to want to get out of there because after a while you need to get around other people, because sometimes you're actually working with a client and you don't see anyone else in that home except yourself. This is the time that a lot of the parents, they disappear and you're there by yourself. So you have to be able to work alone. Okay? What I want to say about the agencies, they pay really good money. Your salary is really good. They pay, to me, better than the hospitals and the nursing homes. One reason is because you don't have to take their insurance if you don't want their insurance. So that insurance money goes on your paycheck. Of course, if you decide you want to take insurance, then it's going to come out of your paycheck. These days and times, a lot of the nurses are not even paying for insurance because you can actually go to urgent care. They're on every block. And when you go into these urgent cares, if you don't have insurance, they're actually going to give you a discount. Okay? And they can write prescriptions, anything that you need. It's just like having insurance. But you don't have to pay for it, not unless you go into them. All right? Working with a nursing agency, you have the opportunity to travel. There are so many places you can actually go. They'll give you a contract. It could be 3 months, anywhere from 6 weeks to 3 months to 6 months, 9 months. And through a nursing agency, you get paid once a week. There are some agencies that actually pay you daily. You get paid every day. But the majority of them pay once a week. Where in the hospitals and the nursing homes, you're getting paid every 2 weeks. Not unless you actually working for the veteran hospital, and then that's once a month. Okay? At the end of your contracts, let's say you take a contract to work 3 months, 6 months, you actually have a bonus. Like I said, you actually have a bonus, and they actually pay for your room and your board, so that doesn't come out of so you're getting a paycheck once a week. You're getting your room and board, okay? Then you actually get a bonus at the end of your assignment. The thing about working with a nursing agency, and you actually decide you want to, now in the hospitals you won't have any problems with that, because in home health, when you're working in home health, you need to put some money aside, because so many times you might have a patient that go into the hospital, because these people that are in the homes, they're sick. And so you never know when they're going to actually go into the hospital. So it's really a good thing to actually put some money aside. So this way, if they're in the hospital a week or two, I have that money set aside. Okay? Another thing that you can do when working with a nurses agency, you can actually work with several agencies at the same time. You can. You can have a patient with, just say, Bayada. You can have another patient with Maxim in the same week. Maybe with Bayada, you're working 3 days a week. Maybe with Maxim, you're actually working 3 days a week. Maybe just in case they don't have, just say, one patient with Bayada where you can actually work 6 days. They only have 3 days available. You can pick up 3 days from another agency. This is what I'm saying. It's up to you. You can choose what you want to do, how many days you want to work. You can choose the hours that you want to work. Most of the hours now is 12 hours a day. Some are still 8 hours a day. Okay. The thing about working with home health, though, when you actually go into the hospital or even in a nursing home, they're going to give you, I would say, the hard patients to work with. Because those nurses will say, well, she's making the big bucks, or he's making the big bucks. Give him the 200 haul with all the G2 feeders. You know, they got this attitude. Nobody told them that they actually had to stay in a nursing home and stay in a hospital and work. They can leave any time they want to and go to an agency. But it's like they thinking, well, she's making all this money, he's making all this money. Let them work for what they get. No, you choose to stay in that position. You choose to stay right there in that position. You're going to leave anytime you feel like it and go to a nursing agency if you like. That's your choice. Okay? Another thing with working with a nursing agency, if they send you to a nursing home, you have to be prepared to work a hall by yourself. Now like I said, I have worked in the hospitals and the nursing homes. So you have to know how to prioritize once you get into them nursing homes. Okay? And I have seen nurses walk in there and they'll say, okay, I come from, just say, Bayada or Maxim, and I'm going to work night shift. And they'll say, well, you got the 100 hall. And when she find out that she had 30 patients on that 100 hall, she turns around and she walk out. Because they automatically think that when you walk into a nursing home, you just got one client or maybe 5 clients. That don't work like that in a nursing home. In a nursing home, you have a hall by yourself. Sometimes you might have 30. Sometimes you might have 40. Because it all depends on whether the other nurse showed up. So if the other nurse didn't show up, then you're going to have your hall and then you're going to have to split another hall. Once you start working in a nursing home, I don't know how these doctors prescribe this medication, but majority of the medications is the same. The only thing that's different is the patient. That's true. I've just about every nursing home that I went to, and I worked in a lot of them. I'm thinking, my goodness, is everybody taking the same kind of medication? You actually know that they're taking the same kind of medication. I don't know how the doctors know, I don't know. I'm not a doctor. But they're actually taking the same kind of medication. Excuse me, something just popped on my video. Anyway, what I want to tell you is this, that working in a nursing home, you can make some pretty good money. You have the choice of who you want to work with, whether it was pediatrics, whether it's school-aged children, young adults, or whether you want to work with geriatrics. Okay? You can work with any population that you actually want to work with when you're working with home health. And the majority of the time in home health, you're working alone if you're in the home. If you are in the home, that client is yours. That client is your responsibility. And you have to be able to know that you're going to take care of this client to the best of your ability, knowing that you're in that home and the parent done gone off. Sometimes the parents will go off and don't even tell you they're out the door. They don't even tell you. You walk in the house, you got report, and as the day go on, you're looking for the parent, the ex-parent, you in the house by yourself. Now, if that's not going to bother you, then home health is for you. I've done it so much, I just know what I'm doing by the grace of God. Now, you do have their telephone number. You know how to contact them. But most of the time, this is when the parents going off and they getting a break. They're out shopping. They're doing whatever they want to do. And you're there. And this is whether the client has a G-tube, a trach, or on a ventilator. That's why some nurses don't want to work with children and pediatric and the small infants that are on a ventilator. Because they're thinking, if something happened, what am I going to do? This is the child. So things can happen, and we'll get into that later. But I just wanted to bring it to you that nursing agencies is a good place to work. I still say, if you haven't watched that video, go back and watch it. I still say working in a nursing home first is good, even before you go into a nursing agency, because you learn so much, and a lot of things that's in the homes, as far as the G tubes and the J tubes, that comes in, that you done already learned that in the nursing homes, except for when it comes to the infants, the pediatrics, they're not in nursing homes. Okay? But I just wanted to bring that back to you, let you know that nursing agency is a good place to work. You're going to make good money. You're not sometimes you might get parents that are breathing down your neck. But some parents no matter what you do, it ain't good. And we'll get into that, and we'll talk about that in the next video and some of the cases that I've had. Okay? But right now I'm going to end that, and think about it. Think about whether you would like to work in work with a nursing agency. And if you don't feel good working with peds, like I said, you got the adults, you got the geriatrics. Okay? Anyway, we'll talk later. If you haven't seen any of my other videos, please take a look at them. Please watch them. And we'll talk again about home health when we come back. Okay? All right, you have a good evening. All right, bye.